incomplete emptying, feeling of urgency when you need to pass urine, and if the upper urinary tract is affected, they may have pain in the stomach or the back side, flank pain, or pain. Vaginal infections, on the other hand, will present with foul smelling vaginal discharge or itching or low abdominal pain.
Dr. Charity Oneko, an obstetrics gynecologist at Bethany Women Family Hospital, adds that the two infections require different diagnosis if patients also get clear explanations.
And unfortunately, when the women visit the health facility, they're asked to collect urine. And most times there is contamination of urine with vaginal fluid, and then they're given a diagnosis of urinary tract infection. And yet the primary problem may not be from the urinary tract, but rather from the vagina.
Good morning once again. Thanks for joining us on Focus, and I'm joined by Dr. Emmanuel Bokolo. He's a reproductive health specialist, and today we want to understand UTI and the depth of it. Doctor, we want to begin with the report as of 2023 concerning the prevalence of UTI, which is at over 24%, and it is increasing. Now, the World Health Organization for it says that it is so much increasing in low-income countries, but especially in children, which I thought this is a thing of older people. Okay. Maybe we can kickstart. What is urinary tract infections? Good morning, and thanks for joining us.
Good morning. I am happy to be here again.
Happy New Year.
Happy New Year too.
Because today is the 9th.
And I've not seen you, I think.
Yeah,
I saw you on...
it's been a year ago.
It's now 1 year back. Amazing. To begin with, I want to join our colleagues in the medical fraternity for having lost one of senior colleagues in Masindi in a way that was so
Dr.
uncalled for. Yes, something that is really saddening to the medical world. A gentleman as he was, I think I've interacted with him many times during COVID and during ICHDs. He was such a very good man. And not because he's dead that we are talking about good things about him, but the humility he would exhibit every time you meet him in office. You would wonder why somebody would kill him
and for me, Doctor,
in such a brutal way.
Yeah, the experience, the time of study invested, all that investment.
Yeah, really. It's pretty sad.
That means that's why something has to be done, really, to find out really what happened. And
yeah, I've read the recent report and this morning, and I'm told a few people have been apprehended, and they are in custody of police. I hope that this comes to the end of it. Otherwise, it was such a shock for some of us who have interacted with a man of his stature. May his soul really rest in eternal peace. Back to UTIs, it's something that is challenging, and for me, I want to look at it at the terminal end of whoever is really trying to think that this is a simple thing, because people look at UTIs as UTIs, and it's quite a common scenario as most people think. For me, I'm looking at it at the terminal end where the kidneys are going to fail.
What?
Yes.
Can it go that far?
Yes. And if we come from that far and then come to the simple things that people look at, then probably people will understand the severity and the necessity of managing UTIs in the promptness of time as much as possible. Kidney failures, where now the kidney is shutting down, its roles are failing, and it cannot sustain a life where people need a transplant. In Uganda, I think we made the first transplant, and I think one of those people was discharged this week.
Exactly this week, and it happened last month in December on the 20th.
So
it was successful.
The discharge was yesterday, or
the discharge was last week.
Last week.
Yes, sir.
So I really noticed a very good progress. But you know, that is, now you look at that young man. I'm sure he's less than 30 years. And you could imagine, I have not read through the details of what could have caused the kidney failure that needed a kidney transplant, but that is the extreme of what UTIs can really help, the hell it can take you through, and there are few people that can really afford some of those things, you know. And why it starts like a simple UTI, just as you said. And when we're discussing UTI, we are looking at a urinary tract from the urethra, which is the opening of the external opening of the urinary tract where that urine exits the body through that small pipe. I would call it a pipe. And when it goes into what we call the bladder is the other connectivity. You know, the urethra has many: membranous urethra, prostatic urethra, and depending on where it is going through. And for men and also women, it goes through, for women, what they call the perineum.
The producer will give us those pictures.
Yes, and, yes, the urethra, when it's for a man, once it leaves your penile area, then it goes under where wedda wetwavuganga eggaali ojjukiranga wetwateeka omuti we gwatulanga awo kati awo nawo urethra eyita then it goes up into the bladder, and then that bladder is also part of the urinary tract, just as my colleague has put it there. And then those tubes that are in yellow that people are looking at are the ureters.
Okay.
Usually, actually, it also has issues once somebody gets pains in the loins, in the back pains. Most likely, the ureters have problems with it, and then it goes up into the kidneys. Okay.
Okay.
So the kidney is a complex organ also on its own that creates part of the system of the urinary tract. So anything that affects any of those parts is called a UTI. But we can categorize it, whether now the nephrons are the ones that are infected. The nephrons are drainage systems that is now detailed. The nephrons are found in the kidney itself, quite a number of them. And if they are the ones that are infected, probably it is systemic or it is an ascending infection. Ascending meaning that it is coming from the lower parts and then it's coming up into the upper parts of the kidneys. So once the nephrons are infected in big numbers and they can no longer function just as they should, most likely somebody is getting into kidney failure. That the kidney is what he has shown us there. And in its details, that alone, as people look at it, it has a lot of details, including calyces and all these other things.
If producer can get me the kidney, I want to look at those. Yeah.
So those details there, if he can give us a picture now, we can try to help people understand why it is necessary for somebody to take care of their kidneys by effectively treating a UTI.
Wow.
So if it is a nephron, then we call that a nephritis or a nephritic nephritis or pyelonephritis. Once pus is starting to form in the nephrons, perfect. That is what I'm talking about. Now that's the complexity, at least on the nearness to it. Okay. Now you can look at the veins that are taking into the blood. Draining the kidney, and also the arteries that are
the blue veins.
The blue is the vein. Okay. The red is the artery.
Okay.
Okay. And now we can look at this and then understand that the detail inside it can actually get infected. Wow. And up here, it usually has a cap like the adrenal glands, okay? And in case the adrenal glands are having a problem, you remember the lady that used to be at NTV when she got adrenal gland cancer?
Yes, yes.
Nankabira, one of the first ladies that were on air. So that is also up there at the kidney, up. And once it is affected, a lot of issues are coming through with especially the hormones that can try to help us balance our sizes and all these others. So if you look at that complexity, the calyces can be infected, the nephrons that are details. Now here we are not seeing the nephrons because it's not the most detailed of it. And also the Bowman's capsule that is helping us to drain through. So all those details that a person may not understand, you see, those looking like veins, looking like trees, how we can appreciate them there, and how they drain into now the ureter here, and now the ureter drains into the bladder, all that is urine coming through. And one of the things that people need to understand is that once the kidney is infected and has a problem, you're going to get a back pain, you're going to have issues with the releasing of urine, and some of the kidneys shut down, and then we get a problem with kidney failure. When the kidney can no longer have an ability to process out urine and then balance up most of the fluid intake, the fluid flow, and also the ammonia that would have been draining through the urine, the urea, and that would be draining through the urine, and then somebody's getting a very toxic body. Okay, so somebody dies out of pain, somebody dies out of swollen face, swollen body, and very compromised health. That
just as a result of urinary tract infection.
That is compromised, that is not well taken care of, and that kidney can shrink, it can collapse, it can shut down, and people can start to notice these, but those are the advanced levels, some of which start as simple as a urethritis. Okay, so once we go back to the ureters, those are the ones in case they are inflamed. The ureters, the yellow now, the yellow that now the colleague has put, then we get also problems. We can get a problem with the bladder itself, where the urine is stored.
Wow.
Either it cannot contract and relax, and then it empties the urine properly, just as the Charity has just been talking about failure to empty the urine, the bladder completely, because it cannot fully contract and then release the whole urine and empty it through the urethra. All that could be because the walls of the bladder are infected, and then we have a cystitis, and also we can have it congested. It is the wall inside is fully congested, like you see. Have you seen a cup that is coated? Maybe with hard water or something, the bladder can get coated once it's in.
Actually, it happens when
becomes a problem.
You have a cup and you overdrink maybe tea leaves.
Coffee or tea leaves.
Yes, and it really becomes dark with a lot of coat of the dust or the coffee dust. And that's what even happens to the kidney.
Even that bladder can become become a problem. And now once it is compromised, that means somebody cannot empty the urine properly, and then that is also another problem, that the unemptied urine alone can become a source of infection as a colony of many microorganisms. So this is as simple as it looks like there, but once it becomes complicated, then somebody's getting a challenge.
So doctor,
lifetime.
Urinary tract infections are not just mere infections. It is really a bad subject.
No, that's right.
My goodness.
And most people take it as simple because they don't understand the complexity of what we are looking at. These kidney failures that we are looking at, most of which are infection related, that have shut down the kidney, and people are now suffering, and they are spending lots of money to go to India. We are lucky now we have it here.
Yes, thank you so much for coming in, and I thank God who really led us into this, because most of the take-home I've had from doctors, they've not gone to the depth like you're digging that. Guys, it's not just on the surface, just urinary tract infections, but it is on the depth that your kidneys will shut down, that your bladder will fail, and before you know it, you're just signing your death certificate.
Exactly.
Because I had a different opinion concerning kidney failures, maybe something else, but now we talk about urinary tract infections. Now, doctor, my goodness, we are understanding the depth of urinary tract infections and how it can really pose a great impact on our lives.
Yes.
So, okay, who is at risk? Depending age and sex, who is at risk? Because I thought this was a women thing.
Yeah.
Now it is crossing over to
it cuts across, but the susceptibility is dependent on the vulnerability of somebody, what is predisposing them to the infection. For example, the persons that are diabetic, okay, if you have high levels of sugar high levels of protein in your urine, high levels of hormones, especially in pregnancy, the susceptibility increases. And also for us men, we're a bit lucky that our urethra is a little longer compared to the urethra of the women, which is a bit shorter. And the proximity of the urethra to the vaginal tract, Charity has tried to explain it pretty well, that it is easy for any microorganism from the vaginal tract to the urethra because of their proximity. They are neighboring each other. And so the women become more susceptible.
Can you help us to show us here?
Yes, and when you look at the vaginal tract and the anal area,
it's if you could take away the lower third.
Yes, they are quite neighboring, especially for women. So it is easy for somebody to have an infection that comes from the rectum or from the anal area and gets into the urethra, depending on the hygiene of that somebody. So the susceptibility, it is more common in women, and definitely the presenting complaints can come in a little quickly. And even those that are highly sexually active, especially those that are
sexual network, mild partners,
practicing sex that is not the best that we know as the normal practice.
Are you talking about homosexuality?
The anal sex, and then after anal sex, then somebody does the vaginal sex, and then
anal sex has an impact.
Definitely, you are removing the flora, the normal flora that would be in the anal area, in the rectum, and then transporting it to the vaginal tract, and the nearest to it is the urethra. It's so close, the vaginal opening and the urethra, just so close. I wish my colleague could, but it become a bit disgusting for some that are not in the health world. So the proximity is quite close. It is quite close, so the urethra can easily be infected by anything that would be normal for the vaginal tract, but not normal for the urinary tract. So that also becomes a problem. Other people that are susceptible, like we've already said, that having multiple sexual partners, that can you transport one to another, and that also becomes a bit challenging. But for those that are diabetic, their immune responses are a bit low, okay, and definitely sugars itself can be a colony for some of these microorganisms that can easily, that may not necessarily affect Mr. Chinto because he's diabetic free, but can actually affect a person who is diabetic. In pregnancy, for example, there is a hormone called progesterone, okay? It somehow increases the size, the dilatation of the urethra, and once the urethra is open, for men, it's difficult to see the urethra unless you're passing urine. But for a woman, during pregnancy, it opens up a little because of that hormone, and also because of the pressure of the baby, that it somehow makes it a little dilated.
Does that explain the reason why there's so many high chances of pregnant women contracting UTIs?
Perfect. So, and I'm happy you do quite a good research to make us understand more of these things that I even leave out. So that's the explanation as to why, one, your immunity is down
as a pregnant
woman, and two, the dilatation of the urethra, meaning it is open. It's like living
it's so exposed.
Open. Yeah, it's so exposed. So microorganisms can easily have access to the urethra, and then later on transport this to the bladder, to the ureters, to the kidneys. That somehow in pregnancy we even have what we call hydronephrosis, that urine is retained in the kidneys because it's not fully drained. So definitely in pregnancy, especially as it grows, the pregnancy gets into 6 months and 28 weeks and above, usually you can have a bit of minimum hydronephrosis, and that also compromises the quality.
Majorly because of the pregnancy?
Yeah.
The baby is suffocating certain organs in the body? Okay.
But also now once the UTI comes and finds the hydronephrosis there, then there are chances of complicating this quite much. So these are the things that we really need to tell our listeners, our viewers out there, to understand the necessity of rightly understanding UTIs and the quickness and the promptness of treating them and completing the treatment.
Wow. Now,
Yes.
this takes me to one. What could be the symptoms that when I notice this, I quickly rush to the health worker?
Most of us need to understand the frequency of our passing urine. Okay? One, I know that I pass urine maximally 3 times a day in this volume, depending on how much I've taken in anyway, and depending on the temperatures of the day. And if I take a cup of tea just as you're doing, and then it's a bit cold as it is in this area, I expect that the only way my body has to release the excesses of water is through urine. And the excesses of heat, that is how it also passes. You know, the kidney can also play a bit of regulation of temperature through your release of urine. So now, once you see a variation in the frequency, what Charity has just been speaking about, the frequency of micturition, that's what the health workers call it. Now, if the frequency is increasing, you are either having a challenge with the urinary tract or you're having a challenge with your sugar levels. Okay? Most likely the sugars are high, so you're releasing a lot of volumes of urine. And now the other sign could be the irritation as you're passing urine, as in the dysuria that Charity has talked about. That is not normal. Anything that causes pain as it is going out is now becoming a challenge to us as a person, whether a woman or a man. And for a child, unfortunately, the only way they will notify you that they are having a problem with passing urine is that as soon as they are passing it, or during the process of passing it, they will cry. And this is not something that should be happening in children. So anytime you notice for your child that they are passing urine and it is, they are crying, it means that either their lower abdomen is having a problem, or the pain itself that is getting through their urethra that is causing them irritation, and then the only response is to cry. So the other issue is the urgency. You know, somebody is feeling they should have that promptness of passing urine. They have gone to toilet, they have passed urine. After a short while they feel like they didn't do it well and they are going back, and then after going back you're passing a very small volume of urine, and after 30 seconds or 30 minutes or even 5 minutes you feel like you want to go back to the toilet. That could be a problem with the urinary tract. And the other issues is about the colors of the urine. You could be passing blood in the urine, and that has not been the normal. And it's not normal to pass blood in the urine. You are either having hematobium, or you're having an injury to your bladder, or one of the sections of the urinary tract, and that could be an issue that you need to respond to as a person, to go to the health worker that is well learned, well educated, and knows the promptness, the quality of medicines that they need to give you, and the volumes and the quantities that they need to give you. So once you are noticing some of these signs and symptoms, the lower abdominal pains, for example, for us men, we don't have a uterus here, and the only thing that we are having in the lower segment of our abdomen below the umbilicus, probably it's the bladder or the sigmoid colon, that maybe also the ureters that are getting into the bladder. And one of the reasons that we are having challenges like that, especially if it's not a referred pain, is because one of the sections of the urinary tract is having a challenge that is being compromised. The same to ladies that have low abdominal pains. Even for children, once you touch the child and they have tenderness that you're pressing along and it's having a problem with or just a simple touch and it's causing a problem on their low abdominal sections, then please respond by taking this child to the health worker for further exam, and then later on investigations that will draw us to a conclusion on what is the challenge with the systems that we are talking about.
Amazing information. Now, for those just joining us, this is Dr. Emmanuel Bukolo. He's a reproductive health specialist, and we try to understand the depth of urinary tract infections and their impact on our kidneys. Uganda has been grappling of recent with kidney failure. It is on the rise, it's quite prevalent, and people are wondering what is the cause. Now, today we're learning that the impact of urinary tract infection is posing a great threat to our kidney, hence the failure. We'll take a break. When we come back, we're going to dive into the depth of this. Good morning.
Focus on Healthy Morning. Bethany TV for Health. Are you looking for a platform to advertise your business and boost your sales? Bethany TV got you covered. Take advantage of our introductory rates and maximize your leverage for brand awareness, advertising, product launching, live coverages, activations, and so much more. For booking and more information, contact our sales team on 0785 576 269. Bethany TV for Health.
Child health and well-being, the foundation for a bright and promising future. Join us for exciting episodes aimed at optimizing our children's physical, mental, and emotional health with our team of experts, including pediatricians, nutritionists, and child psychologists, every Wednesday at 8 p.m. on Bethany TV.
Bethany TV for Health. Are you ready for this good news? You can now watch Bethany TV on Yo TV, AfroMobile, and Airtel TV apps. Yes! Catch the finest programming prescription for everybody, wherever you are, whenever you are. Bethany TV for Health. Exciting news for all viewers of Bethany TV. Bethany TV, the premier health TV channel in Uganda and Africa, and also your favorite TV station, is now on Star Times. You can now watch Bethany TV day and night, weekdays and weekends on Star Times, channel 271. Catch your favorite programs on health, wellness, entertainment, and so much more. Bethany TV is also available on free-to-air, GoTV, YoTV, Airtel TV, and AfroMobile apps. Not forgetting online via our website www.bethanytv.ug and social media platforms at Bethany TV UG. Bethany TV for Health. Showing on Bethany TV. Have you gone through a dire health situation where people imagine you could never come back from? Or do you know of any person who overcame a life-draining situation? Inspirational stories, motivational journeys, predicament after predicament. Winnie Babazi dives deep into their roller coaster experiences, but most importantly, how they overcame. Don't miss Be Hopeful, featuring medical experts' advisory on every experience shared.
Your story can inspire, encourage, and give hope.
Mondays and Tuesdays, 9 a.m. Bethany TV for Health. Bethany TV for Health. Focus on Healthy Morning.
Good morning once again. Mwebale kutwegattako oli ku Health Morning. Erinnya lyange nze Kintu Mutesasira Senior. Negatiddwako Dr. Emmanuel Bukalu, mukugu mu nkola z'obujjanjabi bwa kuzaala, reproductive health specialist. Kakati tubali twogera ku bulwadde buno bwe bayita urinary tract infections oba UTI. Kyabunoonya mu Luganda, UTI. Naye Dr. bwe tugendedde tukizudde nti obulwadde buno bukambwe bwa bulabi nnyo okusinga bye tubadde tumanyi. Nti otunnyonnyodde n'otugamba nti tebukoma jjasi kuluma bulumi naye bwe buvuddeko ku kuleeta obulwadde bw'ensigo, ensigo ne zinafuwa, akataago ne kanafuwa nga tokyasobola kufuuyisa bulungi, kufuluma, tekakyasobola kwerega, kugamba ebintu byonna ne bitaataaganyizibwa. Obuseke bwonna obugenda ku kataago, obugenda mu nsigo, obusuwasuwa, UTI zo ne zisobola obukosa. Abakyala ab'embuto bajjanjaba nnyo UTI ono nga tawona.
Okay, abadde atuwuliriza mu Luzungu nga n'Oluganda alumanya ate yeesiimye. Oluusi njagala nnyo okufaayo ku audience yaffe ey'Oluganda olw'ensonga nti mwabasoma kati oli awo oli mu kunyiga ssimu oyagala kuzuula birala bisingako bye twogedde, olw'ensonga nti olina access to information oluusi Oluganda atakimanyi nga bwe kirina kubeera. But all still twagala okubuulira omuntu nti kino ekirwadde kye bayita UTI kati omusajja the first Muganda takimanyi mu Luganda, nange simanyi ngeri gyakinnyonnyola mu Luganda, naye ndowooza bulwadde obuli mu bitundu ebifulumya omusulo n'ebikola omusulo. Awo wonna kasita ofunawo ekirwadde awo kye bayita UTI.
Bwe tunaabuyita obw'ekikaba tuba tugenze ate mu STD.
Tuba tugenze mu STIs. Kati obulwadde si bwa kikaba. Bw'omuntu afunye UTI tekitegeeza nti akaba wadde.
Yes.
Naye kitegeeza nti afunye obulwadde oba obuwuka okuyingira bwe butalina kuyingira mu kitundu kyonna ekikola oba ekifulumya omusulo gw'omuntu. So ombuuziza ku kyo mukyalo w'olubuto nti kiki ddala ekiba kimutabudde. Twayogeddeko ku mukyalo w'olubuto ekisooka nti omwana bw'atandika okukula atandika okunyigiriza akawago ke ge tuyita urinary bladder. Tuyina bladder nga bbiri mu mubiri, tuyina gall bladder eno eri waggulu eno nga ku kibumba, ne tuyina ne urinary bladder yeno ekisawo ekitereka omusulo. Omukyala w'olubuto usually abeera compromised nti ekisooka omwana atandika okunyigiriza ku lubuto. Ekyokubiri nti anyigiriza ku bladder. Ekyokubiri nti bw'aginyigiriza either yeemputinga yonna oba oluusi esigazaayo omusulo omutonotono ogusobola okubanga gutuleetera infections mu kawago ke akatereka omusulo. So ekyo nakyo kitucompromisinga ku bulamu bw'omukyalo ono ali olubuto. Naye n'ekyokubiri tukyogeddeko mu Luzungu wali nti omukyalo ono areleasinga ekintu kye bayita oba afulumya ekirungo kye bayita progesterone, kituyambako mu kukuza omwana n'okuba nga olubuto terumuwandula, uterus temuwandula kubanga emufulumya ebweru, n'aba nga asobola okubeera sustained mu bulamu bwe munda mu nnabaana ye kubanga kiba kintu kigwira mu muntu. So progesterone naye tuyambako mu ngeri emu oba endala okumukuumirayo. Naye ate obulabe bwereeta usually bwebezze nti omukyala w'olubuto egaziya akatuli akafulumya omusulo kye tuyita urethra oba akapipe ako. So bwekagaziya kye tuyita dilatation nti omuntu ono emikisa gye gy'okufuna obulwadde gyambukako okusinga egya bulijjo kubanga kaba kagaziyeemu. So ekyo ekirungo nakyo ne kituleetera embeera bwetyo. Kirungi ku sayidi eri ey'okukwatirira omwana naye ate oluusi kituleeteramu obulabe mu ngeri y'omukyalo ono okubanga urethra ye oba akapipe akafulumya omusulo kaba kasobola okufuna obulwadde mangu. Ekyokubiri nti katera okuliraana nnyo n'ebitundu byebyo ekyama eby'omukyala byonna byakyama naye the vaginal tract kakati kati simanyi obukyala bwe ndowooza wayita omwana awo nawo watera okuliraana ennyo kubanga watera okuzimba muko bw'abanga abakyala bafunye embuto because of the hormones that are flowing watera okuzimba muko. So somehow gundi nebanga efunze distance from the vaginal tract to the urethra nebanga efunzeemu nakyo kisobola otuleetera obuzibu kyova olaba bo bafuna urinary tract infections oba obulwadde bw'omusulo obwo nga bweyongerako okusinga naye ne immune responses z'omukyala mu pregnancy zibaako wansi
kugamba
amaanyi agalwanyisa endwadde gaba matonoko kusinga kuga bulijjo
kubanga kati bali abantu babiri abagabana ebintu
bagabana almost the same environment oli mutuufu so ebyo byonna bisobola otuleetera okubanga ow'embuto asumukakoko okusinga ono atalina lubuto mu kulwala endwadde bwezityo so ezo ensonga tewabeerayo nnyo kiraayo ky'amaanyi
kakati UTI ayawukanira wa ne vaginal infections?
Tulabye system eno kyenva nginnyonnyodde urinary tract is urinary tract lwakuba nti mu lusawo tugiyita genital urinary tract infection because it's the genitalia naye reproductive system eviira ddala ku vaginal tract eyo gy'ogambye obukyala bw'omukyala neyingira mu nabaana neyingira mu ovaries neyingira mu fallopian tubes neyingira mu ovaries ezo systems ziri bbiri zaawukana newankubadde nti ziriranaganye kiringa mumwa na nnyindo omumwa gutandika the digestive system GIT ennyindo netandika respiratory tract so bino byawukane newankubadde nti birina we bimitingira eno emabega mu bulago naye ate bino urinary tract ne reproductive system tebiina nnyo we bimitingira
jasibiriranaganye
era kyoba olaba nti kyangu nnyo omuntu okukola mistake okuyita vaginal infections n'aziyita UTIs over the other way around
era kyangu nnyo omuntu okujjanjaba UTI naye ng'ekizibu kiri ku vaginal
infections vaginal infections ziranging okusinziira ku kyeki gireese ekisooka ayinza okuba yafunye ekizibu ku Bartholin's gland Bartholin's nayo gland eri awo ereeta nnyo fluid mu mukyalo okubanga ali lubricated bulungi ekyokubiri nti ayinza okuba nga agifunye ku walls zaayo the vaginal walls have a problem so ayinza okuba afunye bacterial infection
ng'azigyewa Dr. Mpulira ogamba ayinza okuba afunye
asobola ozifuna
nga bwentambula wano osobola ozifuna
nedda for example abantu bwe baba beeyonja nga bava okukola long calls omuntu akola long call ate neyesimula ng'ava mabega ngadda mu maaso zensobi abazadde abasinga era ze bakozesa nga balongoosa abaana
kyekyo waaki ebintu bino bidda kati kijja mu baana kubanga mbadde nebuuza ate kijja kitya nti kiri nnyo mu baana kuba ekitongole ky'ebyobulamu ekyensi yonna kigambye nti mu Africa abaana beeyongedde nnyo funa ebirwadde bino
perfect abaana bo kati jjukira muzadde ayagala kukozesa pampa emu olunaku kati omwana yakozeemu susu omwana yakozeemu pupu agenda okugikyusa nga obubi bwonna bwasaabanyedde eno wansi ku mwana ne mu bukyala bwe oba ne mu busajja bwe so meaning nti otransportinze ekitalina kuba mu kifo we kitalina kuba
obijje namba 2 n'otwala mu namba 1
okoze bulungi okyogedde bulungi so n'abazadde bwe baba balongoosa abaana omulaba nga toilet paper oba wipe agijje eno wansi bwajambusa waggulu
kyokka nga tekyandibadde
nti gijje okola mabega bwoti osiimula omwana naawe wenyini omuntu omukulu agezaako kugamba nti njijanjabi UTIs teziwona wegendereza ekintu ekyo bwoba okikola era kubanga eno E. coli erina okubeera mu normally esobola okubeera mu GIT naye ate terina kubeera mu urinary tract so waliwo obuwuka nga bwo buli mu mubiri nga buli nnomo butuyambako okubalansinga embeera naye
buvaayo
ne budda ewalala ng'ate awo mu kitundu ky'omubiri obwo busobola okuleetawo obulwadde
kakitegeeza nti woba ogenza okwesiimuula omaze okukola namba 2 longoko oyina kuva wansi ng'odda emabega va maaso ng'odda mabega so tova mabega ng'odda maaso nga weesiimuula
ng'obitadde we bitalina kubeera especially for women for men most likely it's not compromised. Olaba rectum, or good, this is a good picture. Olaba rectum weyo, olaba nti chinyana mpindi.
Rectum yeri wachecha red.
Wano wansi, no wano wansi. Eche ekiringa ekipipe ekiva waggulu wali awali akapande ka Bethany.
Okay.
Eche ekipipe ekikirira wansi.
Okay.
Eyo omusajja omuntu yenna wafulumira kati awo awaddako awo wali red. Ate bwe bukyala bwaki bw'omukyala kati ate wana awali yero waggulu we wali urethra. Obiraba nti byonna biri kumpi biriranaganye. Afulumira ene wasemba. Afulumira eno nayeeyonja ng'azza waggulu. Obulwadde bugenda kuyingira wano
jeno nga zeno.
Ate wano we bubeerawo neighbor ono bagamba omuliraano gwokya bbiri. So olugero we lutuukirira ne lutulaga nti omuntu asobolera ddala okuba ng'afunye ekizibu. So all these are things that we need to take care of in terms of hygiene. Waliwo n'abantu nga tebeeyonja bulungi. Oli n'amala okwegatta nga teyeeyonjezza. Munna ayinza okubajja eri ebirwadde n'abimuleetera n'ateyonja
ng'ate bandisoose oba kunaaba nga tebannagenda mu kikolwa bulungi.
Especially abaami nga toli mukomole. Usually obucaafu bubeera mu nga tosobola kukuuma hygiene obulungi. Era weetaaga okunaabako ne bwoba wanaabye emisana naye ate olweggulo oba nga ogenda okubeera ne munno naawe eyonjeeko olimuleetera ki?
Sabbuuni ono abakyala gwe bakozesa mu bukyala bwabwe tabakosa?
Ideally tetwetaaga kulongoosa munda mu bukyala kyetuyina vaginal douching, kyetuyita douching of the vaginal tract. Obukyala bw'omukyala butera okweyonja bwokka.
Katonda bwetu yabukola.
Bwe yatonda. Nga bw'olaba nti bwenfuna ssenyiga, bwenfuna obulwadde mu nnyindo, ssenyiga ajja. Bwenfuna ekizibu mu maaso, amaziga gajja. Engeri ya kuyonjaamu liiso na kuyonjaamu nnyindo.
Yinza ki tulina n'obukowekowe buno okuziyiza enfuufu ennyingi.
Ne buno waggulu wano ne butuyambako okuziyiza egundi sweat entuuyo okuba nga zijja straight ne ziyingira mu liiso. Wano era bukuyambako okutaasa. So Katonda yakola system ezo nga
mpa amasimu abantu bakube essimu babuuze dokita kye bandyagadde okubuuza ku UTI ne vaginal infection. Ye dokita ng'ogenda mu maaso. So ku katale tuwulira balanga vaginal wash, waliyo ebyokunaabisa mu bukyala ebibalongoosa.
I'm not in for them. Nze. Maybe some other people can support them. Because I know the full range of the physiology of the vaginal tract. Era omuntu teyandyetaaze nnyo kuba nga ayingiza engalo azisonseka mu bukyala bwe ateekayo sabbuuni and all these things. Washing on the external genitalia is okay. Okwoza ku ngulu kuyo. Postural drainage yo yennyini ekyekolera. Okay? Neweeyonjaako n'olaba nti I'm fine externally. Yeri bw'oba owulira nga drainage ezze, you go to the bathroom era naawe n'okola ki n'osigala nga washing externally.
Dr. social media eno nnungi naye ate era erina byetuleeteddemu okugikozesa obubi. Omusajja omu yagamba muyita GKMCC as a bishop yagamba nti where the purpose is not known, abnormal use is inevitable.
Pardon me?
Where the purpose is not known, abnormal use is inevitable. Yes, that's why we have child abuse, parent abuse, pastor abuse, husband abuse, drug abuse, because we don't know the purpose or we not understand the purpose. Tufunyeyo abantu kakati nga bakwata garlic, cloves, nga bazeesonseka.
Ng'olidde.
Mbo bawone.
For example, katika ngeze ku sabbuuni gwoleese ow'omuti. Baamuteekawo kutta buwuka. Mu vaginal tract oba mu bitundu by'ekyama eby'omukyala mulimu obuwuka obuli nomo. Akasooka lactobacillus vaginalis. Okay? Kabeeramu normally. Okay? Meaning nti sabbuuni bw'ayingirayo era katuwa balance y'obukyala obwo kubanga bwekuumira mu kigero kya levels eza acidity. Acidity nti pH mu luzungu simanyi, mu Luganda simanyi pH kyeki. Bwe yeeyongera waggulu n'enkwasi z'omwami zisobola okufiira mu pH eyo. Kyova olaba abakyala abamu because of their pH being high, lactic acidosis, the lactobacillus eriwo tereleasinze acidity emala okubanga ekuumira ekitundu ky'omukyalo oyo mu levels of acidity eri awo empola mpola omwami bw'adipositinga spermatozoa zifiira omwo.
Kati ogwe kulaba nga banoonya omwana talabika.
Ogenda okumubuuza nti how do you clean yourself ng'omulaba nti yo yakozesa sabuni medicated soap and bar soap and all these other things, and then when you advise them that you stop it and give it at least the next 3 to 6 months nga normal flora ekomawo normal ebintu ebibalancing normal flora natandika okuba nga asobola okufuna pregnancy. So that is the simplicity.
Bano abana basabuni abana bikemicals njaga okutumirako omukwano gwaffe Francie Mbabazi ali Michigan mu America alaba nnyo programu eno era anyumirwa nnyo programu ya buli wojja, so njaga kumutumira kabeera agoberera otulo atuvaamu n'agamba nedda kandabe Mbabazi bwe bali kulaba.
Balone yangambye ku Lwomukaaga nti lwaki oyagala nnyo tuula bwoti naye kati ndooza kantereere yakikoze
oba naye kati ntandika okukakupa okuba bunaye serebu kakati andi waliwo tojjukira oli yajja n'ayogera ng'agira yenze gundi akati ne kafuuka nno
so kangezeko okutuula kubanga
ogezeko okubaawo empisa anti twawudde olw'akasente gavumenti kegenda okuyisa okusomesa baminisita empisa nga tugenda mu lukuŋŋaana lwa naamu naye minisita w'ebyobulimi Frank ye yagambye nze sijja bigendayo kyemugasiina anyway katuvudde so doctor ebimu ebireese obuzibu UTI vaginal infections butamanya nkozesa bye knowledge yetufuna distortions misinformation nti oli yafunye oli bamugambye kola boti sonsekayo galiki sonsekayo gundi kati kumbe ayongera so tugambye nti munda Katonda mu bukyala bw'omukyala Katonda yassaayo obuwuka obuyamba okulwanyisa obukyafu teweetaga kusaayo sabbuuni simanya waashi simanya kusaayo hani ebyo byonna tebyetaaga.
Others even are misusing antibiotics olw'ensonga nti first obwojja w'omusawo mba mmanya nti okusinziira ku kirwadde kino antibacterial antibiotics zenina okuwa tezirina sukka nnaku bwe ziti.
Doctor oneesoose maaso kyekimu kyembigenda okubuuza negenda maaso kwamba neyakubuuza what is the best antibiotic
tetula naziweera wano kubanga oli ajja kukikola nga we bakola mu covid batugambye dexa akola ne bagenda ne beegulira dexa zaabwe so oba omanya duration nti okusinziira kawuka ke tukoze wano for example tukoze HVS oba high vaginal swab oba netukola urethral swab whatever oba ng'oswabinze awo n'olaba nti this is chlamydia oba this is gonorrhea oba this is syphilis then omusawo yamanya ekika ky'eddagala kyagenda okuwa n'ebbanga lyagenda okukikuweeramu gwe bw'onaalyewo oyinza okwewa excess ate ne zitta obuwuka buli obulina okuyamba okubalansinga omubiri gwo ne lactobacillus gye twogeddeko esobola okufiiramu n'otandika okuba nga obadde ku antibiotic n'ofuna super infection n'ogenda okulaba nga ate bw'abadde ku antibiotic ate otandise okufuna candidiasis oba candida abantu gwe basinga okumanya candida ng'ate ebyeru bitandise okuvaayo naye ate ng'obadde ku antibiotics so ebyo byonna biva mu imbalance and improper management of these things bye twandirowoozeza nti byetaaga okuba ebyangu. Nkubiriza abantu taata wange mwami kintu nti baleme kwejjanjabanga bw'oba osobola ng'olina obusobozi genda ew'omusawo akutegeerere.
Nkusaba mu seconds 3 agasembayo Cameroon oyongera okukkatiriza ekyoyagala okusembayo nakyo ku nsonga zino doctor.
Tewejjanjaba kubanga teweetegeera nnyo kyova olaba waliwo abaabisoma ekyeneewuunyisa ennaku zino bw'oba oyagala owa kamera awo teweetaaga onoonya baabisoma naye ennaku zino omuntu bw'alwala asookako wassengaawe n'akubira kojjaawe n'akubira omusawo w'ekinnansi n'akubira such that by the time we bajjira mu ddwaliro at times some of the things are late ngatufunye complications ingeza hidden failures.
All right.
Yes,
Tuwadde Dr. Emmanuel Bukalu Mukugu, reproductive health specialist nga tuwogera understanding urinary tract infections, the causes and that deeper impact on our lives. My name is Chintu Mutesa Senior. Until we meet again, it's been quite informative and insightful. Hope you join us tomorrow, same time, same place. God bless you. Bye.
Focus on healthy morning.